Nurse Choma, founder of Choosing Nursing. Today we're going to be talking about the HESI admission entrance exam, and we're going to be focusing specifically on anatomy and physiology. All right, so let's talk specifically about what is the anatomy physiology component when it comes to the HESI exam. So this is going to take about 25 questions, and you have about 25 minutes to complete the anatomy physiology area. Now this is an area that a lot of students are kind of a little bit intimidated by, fearful of, aside from some of the other components of the test. But anatomy physiology, it's all about understanding or demonstrating your understanding when it comes to anatomical structures and just the general anatomy of the human body. And so now let's address exactly, what is anatomy and what is physiology, and then we'll go into some key components to help you to get in the right direction. So what is anatomy, right? Anatomy is, like I mentioned earlier, it's describing the structure or different parts of the human body, all right? Different parts of the human body, all the way down even to like the cellular level, just really explaining really your ability to understand what are the different parts of the human body. What is physiology? Well, physiology is now how will you understand how those parts work together, right? How will you understand how the processes actually work when it comes to all these different pieces, all these different parts of the human body? So let's do an example when it comes specifically to anatomy physiology, and we're gonna do the heart. All right, because I know that the human heart, the heart is one of the biggest struggle areas for a lot of people, and for multiple reasons. But we'll talk specifically right now about the heart. So first I'm going to describe with you the anatomy, right, or different anatomical parts of the human heart, and then I'm going to go over with you a physiological process when it comes to the human heart. And this, what I will say, what I'm going to teach with you today will help you to better understand how to merge the two together, right? It will help you to better understand, just kind of hopefully refresh some of your memory, expose you to it, help you to learn how to memorize it, understand it better. And then hopefully what you can do is then now you can begin to apply this over and over again to other parts of the human body. And today I actually have with me my book. All right, this book is awesome. You will enjoy it. Like if you're somebody where you're super hands-on and you really need more like hands-on, you'll probably enjoy this book. This is what it looks like. I will post below. Actually, this is what it looks like. It has English and Spanish. So if you are a Spanish speaker, this will help you as well, because there's literally English component and then there's a Spanish component. But of course, I'm going to talk from the English component. So if you want to get this book yourself, I'll put the link below this video so you can get this book yourself if you know you're more visual. So let's talk about, hopefully you can kind of see this. You may not be able to see it super well because honestly, the letters are very tiny. We could go into more details as far as going over the different arteries and veins throughout the heart, but we'll just go over some of the basic anatomical structures for the sake of this video. So when we look at the heart, now this is the heart, and then of course we have the lungs in the back. And it is important to be aware of how the heart and the lungs work together, which I'm actually going to talk about when I go over the physiology component, because that's pulmonary circulation, which is over here. So we'll talk about that briefly as well. But first, let's focus on the heart itself. So the heart is composed of, you see we have here the aorta, okay? This aorta, and I'll talk about what is the purpose of the aorta. And then we have over here, right here with this component, see number 6, this is the superior vena cava. Now you can't see it, but behind the heart would be the inferior vena cava. Okay, so we have the superior vena cava, which is at the top of the heart, and then we have the inferior vena cava, which would be behind the heart. Then we have two arteries. Two atriums. Right, we have our left and the right atrium, and then we have our ventricles here. Right, so our left and our right ventricle as well. Okay. And then, of course, we have the different valves. So it's important that you're aware of the different types of valves as well. So in between over here, let's see, on this side. So on this side, we have the tricuspid valve. So from the atrium, and right now I'm describing the heart from just focus on the anatomy of the heart, but not necessarily talking about the electrical structure of the heart, which would go into the electrical conduction system. So we have the tricuspid valve, which is the valve located between the right atrium and the right ventricle. And on the other side, we have the valve which is located between the left atrium and the left ventricle, and that would be the mitral valve. Okay, so we have the two atrium, we have the aorta, we have the superior vena cava, we have the inferior vena cava, which is behind, and then we have the two ventricles as well. Okay, and then let's see what else I want to mention with you guys today. Okay, so we'll talk. So those are the main components that we're gonna discuss, and then also we have. It's kind of hard to see it, but before you go into the lungs, which is connected to the heart as well. You have the pulmonic valve, right, which connects between the right ventricle and the lungs. And then you also have the pulmonic artery as well, which is the artery that connects, once again, to the heart to the lungs. And then on the left side, you would have the pulmonic vein, which connects from the lungs to the left side of the heart. Okay, so I know, hopefully that's so once again, just to simplify it, the main structures that we're looking at today is the heart. We have the superior vena cava, inferior vena cava. We have the aorta, which is located right here. We have the right atrium and the left atrium. We have the tricuspid valve and the mitral valve, which is in between the atrium and the ventricle. And then we have the right and left ventricle. Okay, and then we have the pulmonic artery, and then which is hard to see on here. You actually can't see it because that's part of the lungs now. We have the pulmonic artery and the pulmonic valve, and then the pulmonic vein, which is from the lungs to the heart. Okay, so now, and then actually over here, so this picture, so they cut the heart into different angles. They have the anterior view of the heart over here. So because this is only showing like one view, that's why you can't really see everything that I'm mentioning. But this is over here, this is the anterior view of the heart. And then over here, this is the posterior view. So this is the back of the heart over here. And then over here, we have the actual valves, all right, that I was describing earlier. Okay, so this is the picture right here. And then this is another image of the heart, but this is the arteries, the coronary arteries. And the coronary arteries are significant when it comes to the actual blood flow in the heart itself. All right, so the blood flow of the heart, this is significant especially when we look at patients who have coronary artery disease, and I don't want to say the pressure, but pretty much when these arteries are clear, the blood flow is smooth, and there's no issue with the patient's with the pressure in the coronary arteries of the heart. So when a patient typically has a heart attack, one of these coronary arteries are blocked off. All right, so that's describing the anatomy. Now let's talk about the physiology, okay? So now how does all those parts I talked about actually connect with each other? So now, okay, discussing this from how they all connect. So pretty much the way that it works is that we have deoxygenated, right? So pretty much blood that is not, that doesn't have oxygen in it. And deoxygenated blood comes in to the heart, okay? And it comes into the superior vena cava or the inferior vena cava, which is on the other side, all right? Deoxygenated blood, so blood that has no oxygen in it, comes into the superior or the inferior. Then, once it travels down to the superior inferior vena cava, or up, it goes into the atrium, all right? Then it passes through the tricuspid valve. Then it passes through the right ventricle. Then it passes through the pulmonic valve. So now it's going from the right side of the heart to the lungs. Then it passes to the pulmonic artery. Then in the lungs, it gets perfused with oxygen. Okay? So this is why a patient's lungs influences blood flow, influences tissue perfusion, because if the lungs are not are poor, are not effective, then that deoxygenated blood is not going to get full of oxygen and rich in nutrients in order to pass throughout the rest of the body. So it goes to the lungs, and the lungs fills it up with oxygen. Then it comes back to the left side of the heart. First it goes to the pulmonic vein, back to the pulmonic valve, but now on the left side of the heart, the left atrium. Then from the left atrium, it goes to the mitral valve, which is between the left atrium and the left ventricle. Then it goes to the left ventricle. Then it travels up to the aortic valve. So now we're getting ready to leave the body. The aorta and out to the rest of the body. Okay, and that's pretty much describing in simplified version how blood passes through, how it's transfused through the heart, all right, through the heart, how it goes from deoxygenated to oxygenated blood. So important. So if there's different components or different structures of the heart that is either damaged or is blocked up from plaque, then that's going to affect their blood pressure. That's why they're going to have chest pain, right? That's why they're going to have a heart attack. So you see how all of it really wovens and is super connected together. I hope that what I share with you today, you know, kind of give you a picture, helping you to better understand how the heart works. And like I said, that's only one aspect, right? Because that's describing how the movement of blood throughout the heart. Then we also have talking about the conduction system, which is looking at the SA node, the AV node, like how the impulses fire, and that helps you to better understand EKG interpretation, all right? But I hope that what I shared with you today was helpful. If this was helpful, and if you know you need more information in this area, I would definitely encourage you to take advantage of our body systems crash course. Like, let's say you're preparing for your test, you're preparing for your exam, and you really need to get a strong review on the different systems within the body. You need to better understand the anatomy, physiology. Maybe you don't have months to prepare for your test, but you need to get that information down. Then the crash course will help you. It's pretty much me going over all of this, but in more detail, longer, and it's not like this today. It's instead going to be, you know, PowerPoint presentations on top of labs, and then of course going through each system, from the cardiac system to the renal system to the skeletal system and beyond. So I would highly encourage you. You will find it really helpful. To learn more about the body systems crash course, you can go to the link in this bio or below this video, or you can visit our website, which is choosingnursing.net, choosingnursing.net. Thank you so much for watching this video. Make sure you subscribe, like the video, share the video, tag somebody.